Hi, I'm Natalie Tyler with Thrival Medical Center, and this is Mindset Meets Medicine. And I'm speaking with Mike Dulcio. We do this every Friday evening, at least recording, sometimes live. So we'll be recording this one. Mike, I'm just going to title it, and then if you want to introduce yourself, sound good?
Absolutely.
Perfect. All right. So the title of this one is Why Smart People Make Decisions or Still Make Emotional Decisions, right? And what drives behind those emotional decisions. We're trying to understand the brain, emotional intelligence, and better decision making. So, how do we know, or have you ever been known to do something and then immediately regret it? Or do something when you know you should have done the exact opposite? Whether it's sending a text knew you shouldn't have sent, or bought that item you shouldn't have bought. Maybe you should have known you should have done the workout, or you stay in a relationship that you don't think you should stay in, or even a relationship at work, right? Our business relationships when it's not the best environment. Why do we continue to stay? Well, it's not something with you being unintelligible, being weak. It has everything with you being human, and we're going to explain that further.
Excellent. Excellent. Hello, everyone. This is Mike Dulcio. I am an emotional mastery consultant who serves as an executive advisor and a family consultant. I'm very, very happy to be here with you guys alongside Natalie as well. And yes, just like she shared, we're going to be discussing these things. Why smart people still make emotional decisions. See, one of the biggest misconceptions in our culture is that intelligence automatically leads to good decisions, and it doesn't. We've all met brilliant people who've ruined marriages, sabotaged businesses, destroyed relationships, or made decisions they later regretted. So the question isn't, are you smart? The real question is, who's making your decisions? Your wisdom or your emotions? Now, Natalie's going to take a deep dive into that as she discusses the neurological pathways that allows these things to exist, to present themselves, the clinical side of it. I'll be asking some questions as well, and I'll also share my perspective on an EQ sense from an emotional intelligence perspective.
I love your transition. I cannot. You're just so good, Mike. You're definitely emotionally intelligent with our conversation. So we awfully often think of ourselves as, the logical person, or we all think that we're logical in our own way, but our brains aren't wired that way. They're actually wired for survival first. So if we think back to the caveman days, right? Fight or flight. Is this thing going to eat me or kill me? I need to run. It's not sitting here thinking of the logical next step. I know I can think of my toddler in most of these situations, so I'm sure we can relate things. but not perfect decision making, but we have to be able to understand where this comes from in our brain and understand that sometimes it's not within our control, but then hopefully Mike can help us tie it together with some emotional intelligence and some techniques to navigate those. So, the amygdala is a portion of the brain that is in the deep center of your brain, essentially, between your temporal lobes, which is where your temples are on both sides. It's kind of in the middle between though there. This is like our smoke detector. This is our emotional response. So if something's wrong, that's what's going off. It's not going to be able to differentiate between different types of stressors, which I'll get to in just a second. But it's more asking, "Am I safe? Is this dangerous? Do I need to get help?" So it's really that smoke detector I want you to think about. And it reacts in milliseconds. It is not something you control. It's subconscious, it just goes. It cannot always distinguish between different stressors, different problems. So, is this a bear that's about to attack me? Is this a critical email? Is this a stressful relationship? How do I respond? Is it something violent? Stress is stress. It will not differentiate between the two. Your brain, that's just the way it understands it. It's the best way I can teach it to you. So the amygdala is a smoke detector. The prefrontal cortex, right? So it's in the front portion of our brain. Think of it like the CEO of your brain, right? That part is logical. That part is planning. That is the problem solver. In fact, in our younger kids, it's not even fully developed depending on your gender up till 25. So we still are developing the CEO prefrontal cortex. It also is part of our judgment too. When the stress is low, the CEO is in charge. When the stress is high, the amygdala is in charge. Um, this is why intelligent people can suddenly make these decisions that we wouldn't expect them to make, right? You're like, oh, they're a smart person. They should know better. No, they'll leave a job. They'll quit a job when you're like, they shouldn't have. Later, they'll regret it. They'll stay in unhealthy relationships. They'll ignore medical advice. It's just the part that controls us, right? We have to differentiate between the two. It
Yes.
isn't intelligence that's missing, it's access to the logical thinking and that moment. This is where I would kind of like to see Mike's perspective on like emotional hijacking. Does it mean that we're powerless? What do you think, Mike?
Absolutely, absolutely, Nat. People often think that emotion is the opposite of intelligence, and I don't believe that's true. Emotion is actually information, and the problem begins when emotion becomes the driver instead of the advisor.
Right.
So, with the topic of emotional hijacking and emotional intelligence, we talk about something called emotional hijack, like Natalie just mentioned. And that's when the emotional centers of the brain react before the logical sensors have time to evaluate what's happening. It's kind of like they're coming to rescue the situation without understanding the context of everything going on in the moment. Just imagine, if you will, someone cuts you off in traffic and you receive an unexpected text with no real context behind it, or your spouse or partner says one sentence, and suddenly, out of nowhere, you're reacting instead of responding. Your IQ didn't disappear, it simply got overridden. And that's what we call emotional hijacking. And sharing with that, now I'd love to ask you a question from a medical
Sure.
perspective. What's happening inside the body during those moments?
Well, it could, like I said, everything is in like fight or flight initially, right? Survival mode. It's more about reacting than thinking. Everything you said. So, neurologically, your amygdala is firing. It does several things in your body, but what we mentioned already is just that emotional response. Am I safe? Is this dangerous? Do I need to get away? Do I need to stay? It's this like smoke detector. So, it's really part of
Yeah.
your nervous system that's firing. And like you said too, it's milliseconds. It happens. It can happen before your logical brain can catch up. That CEO instead.
Yeah. like I think the principle is we think we there's a misnomer. We think our brain's first responsibility is success. Our brain's first responsibility is not success, like you mentioned. It's survival. And survival doesn't always make wise decisions.
No. Yeah, that's why we have regret and then we work through regret.
Right, right. Um, so, speaking of that, Nat, do you
Yeah.
think people confuse urgency with importance?
Yes. Sorry, I'm thinking of myself, obviously. um,
Yeah,
yes, yes. I think that they do just because something I'm thinking too of things my husband says like your poor planning on your part doesn't constitute an emergency on my part, right? So just because it's urgency, it's not priority for him at least. Um, yeah, no. It's
yeah,
what I would say too is like, and I think this is probably maybe where you're going, or I'm sure you will go at some point, is assessing exactly what you're feeling in that situation. Because sometimes it can come off as a different feeling, meaning like you think that you're mad, for example, or upset with another
yeah,
person,
yeah,
but you're really internally mad at yourself. So like asking yourself like what am I actually feeling? Identify the emotion. You think it's as easy. You could say, oh, I'm angry, but what's below that? Is it really just embarrassment that then triggered into anger? Identify the emotion first would be my recommendation, that beginning part. I'm sure you have more to say though. You're the best. So go ahead.
no. takes the best to recognize the best,
Oh,
man.
there you
Um,
go.
but no, you're absolutely right. And that was such a great example. I agree. Stress. The thing with stress is it makes everything feel urgent,
Yeah.
and what emotional intelligence helps you decide what actually deserves your attention, and that's where we get the reaction versus the response, right?
Yeah.
There's no thought behind reaction, but in responding to a situation, there's some thoughts in the moment, or breathing even, to like capture the context of what's going on
Hmm.
and taking control of ourselves before we actually react to the situation blindly. Um, I
I've had to
think
do
that's a
that a couple of
huge.
times with emails. I'm sorry to cut you off. I'm thinking about work.
No, go ahead, go ahead.
But yeah, no, I know that like whether it's a text message or an email or even a situation, whether it's at jobs I've had, home, relationships, whatever,
Yes,
you have to take a second to breathe, process what was said, process that emotion, and then try to come out with a better response. I
it's
think,
so necessary.
yeah, and I think if you have, I like to say sometimes, I think if you have goodness at the heart of the situation or you give people benefit of the doubt, me personally, that seems to help me with my mindset and helps me with my reaction response. Whereas if I sat here and thought, well, everybody is, you could add anything there, right? Everybody's stupid or everybody's angry or, everybody's incompetent or everybody's a liar. Like if you start out with that, I think that also changes your response. And that can play into
Yes,
many different other things. We could go in wormholes all day with that.
absolutely, absolutely. Now, I know you're in the spaces as a successful person yourself. You're in the spaces. You're I, I know your proximity is around successful people all the time, and you see a lot of successful people. My question is, why do successful people often ignore the warning signs of something like burnout?
I think it's still survival, but in a different sense. It's
Mm,
survival of, well, I have this job. Let's talk about jobs for a second. I have this job. It's providing me with a paycheck. I feel stable in this moment because I know what's coming in and what's going to go out. Um, and I think that that's survival in that sense. I've seen that a lot with my other working professionals, my other nurse practitioners in particular. They didn't leave a very toxic job with toxic leadership, etc. They were just miserable every day and they just drugged themselves into work because they cared about the patient. Um, but it just, they couldn't stop because they wanted to buy a house or they needed to afford their
yes,
lifestyle. Even for myself, like opening ThriveWell Medical Center, it really is just like the passion that drives me. It's seeing what happens every day with our patients and people can't get through to offices and nobody knows how to treat the patient anymore just as a person.
right.
That's what keeps driving me that way. Was it scary as hell starting? Yes. Is it still scary? Yes. But I look to the future. I look to the outcomes. I get more invigorated each day by my patients just telling me, you have great bedside manner, or thank you for listening to me, or dang, really, thank you for digging into that, because that's usually what I do.
Yes.
Um, but I know for me, that's what helps turn around that, that, oh my God, I lost my words. See, that's my brain today. That, like burnout, right?
That burnout,
Um,
that revelation, right?
right. And I can definitely see it. Like if I was, I think if I wasn't motivated, if I wasn't still driving from a place of I'm gonna make this happen, and that might be something that's inbred in it, inbred. That might not be the right word. Instilled in me since I was a kid or adult or whatever the case may be. I think I would have quit. And what I keep telling myself is that if I quit, then I failed. And I only mean that is I am not going to then be successful and see what I want to see to the end in that sense. If I keep going, if I keep picking up the torch and keep going, then it will be successful, or it can be, or maybe in my mind it'll be successful. But I have to, every day I have to take time for myself. I have to
Yes.
sit down with my kids. I have to set out designated time for myself to be able to decompress, because if I don't, I can feel it in my entire body. I just feel this anger and this agitation, and then like you can easily slip yourself into depression. You can feel it where you're just like, I'm just going to live here and I don't
Hmm.
want to do anything, and it's okay. But it's okay to be somewhere like that temporary and come out of it. It's not okay to live there because then that's when you get other problems and keep spiraling. I know I went really long on that answer, but I see a lot of that with people who they just do what they do, status quo, because it's worked for them, and they're afraid of that change because it does. It comes with stress. And that leads us back to our topic of our amygdala taking over, right? Our
So
fire alarm.
it's all interconnected.
It is.
The truth is, sometimes success just becomes addictive, and
Honestly, yes. I don't know if I could go back to working for somebody full time because it's addictive. It's addictive doing all this stuff. I agree. You get that dopamine hit.
and because it's addictive,
Yeah.
people stop. I love the fact that you mentioned listening to your body
Yeah.
because success becomes addictive. People stop listening to their body because everyone keeps applauding their productivity,
Yeah.
and it's a trap. It's a slick, cynical trap because the marketplace rewards production and your
Yes.
body rewards balance. So you ignore one long enough, and eventually everyone, not everyone, you ignore one of those two things,
Yeah.
one will definitely collect the payment.
Yeah. I agree. I've been there. So I totally get it. Both sides. I've been
um,
dumpster on fire
Same
and I
here.
know what it is. So we're going to stay away from that.
Same here. Definitely been there. Definitely suffered burnout. Definitely
Yeah.
got addicted to the trap of success, and
Yeah.
to where we stopped celebrating the success. It
Yes.
just became chasing the next rabbit,
You're right.
so to say. Which would
That
lead to my next question: can emotional stress eventually become physical illness?
Yes, and I think we mentioned that in the last segment too, where if you don't make, what did I say? I always messed up. If you don't make time for your wellness, you will make time for
Oh,
your sickness. At least that's what I'm used to in my own experience. So making sure that you are setting time aside for yourself so that you do not bury yourself into the ground is most important, and keep going from there.
that's absolutely fascinating. That because I often tell clients that your body whispers before it screams. Like it shows up, the
That's so
whispers can
great.
show up. It could show up like fatigue,
Hmm.
irritability, short patience, brain fog,
Yeah.
brain frog. Am I going through it?
It could be
Brain
frog too.
fog, brain fog, poor sleep,
Uh-huh.
and those aren't just inconveniences. They're invitations, rather.
Hmm.
They're signs. So my next question for you then: why do people resist doing what they already know they should do?
I
I'm
think
sure you see it all the time.
I do. That's why I'm laughing because I see it almost every day. In fact, the other day, now that you bring it up, it's not emotional, it's physical. I have a patient who was she had water or swelling in her legs, her lower legs, and she told me that she was taking her friend's water pill. And she never had her own water pill.
Oh,
So, of course, for me, I'm like, okay, is it cardiac? Is it renal? Is it vascular insufficiency? Is it arterial insufficiency? What is it? Just gravitational pull? What the heck's going on? And I was like, okay, well, first and foremost, we need to talk about, compression socks. That's something that is non pharmacologic, so no medicine, something you can do for yourself. You can help with your blood flow, help with all everything. Like, did a whole education. She
yeah,
says, no, that's what old people wear. Mind you, I'm pretty sure she was in her late 60s, 70s. I'm not calling that old. That is an older adult by medical terms, but that was her response, was that that's what old people wear. And I hear that more often than not. And it's funny because I know my parents always say, well, you're only as old as you feel. So I get it and I understand. And most people would be like, oh, that's vanity, right? But to me, it's just somebody who doesn't like the look, doesn't like the feel. They associate in their brain with the stigma of what it is instead of just seeing it for what it truly is. It's to
right.
help you. I know that's a really basic concept, but that pretty much blankets anything else you could ask me about why people probably don't follow through. They're not ready for change. They don't believe that they need to change. And that can go for many different, I think we talked about that in a segment before too. If they don't see the importance or the imminent threat or danger, then they're not, more than likely not going to follow medical advice. And there could also be like a trust thing too. I have patients who have medical trauma, who have trust issues with providers for various reasons. And so then they won't follow medical advice either that way.
So good, so true, so
Yeah.
practical, so simple.
Simple.
You're absolutely right. I've coached hundreds of people, and very few of them lack information.
Yeah.
Most, honestly, they lack emotional safety. Like information changes minds, but safety is what I've noticed changes behavior. And unfortunately, like you said, sometimes it takes a traumatic event, or they're stuck in past traumatic events
Mm-hmm.
to allow themselves to just kind of listen
Mm-hmm.
and apply what's simple or necessary to help protect them for their future,
Yeah.
no matter their age, but it's especially our seniors.
Mm-hmm.
But again, no matter their age, that's why for me, I don't ask people to change their life. I ask them to win today. Win today is one of my biggest quotes. I like to say,
Yeah.
it's just win today. One difficult conversation, one walk, one prayer, one boundary.
Mm-hmm.
Small victories is what restores self trust. But when you think about it, though, I'm like, how much healing do you believe? Well, I'll ask this: as a medical professional, nurse practitioner, who you've been in your field for so long, how much healing do you believe happens outside the doctor's office instead of
Oh,
inside?
probably all of it. Almost all. We'll say like, 1% in the office. But as long as, it's, we probably could talk about this all day. So it's not just what we can do physically for patients, it's also the mental, right? It's also that I think I just had an epiphany when you said that. It's about that emotional safety or emotional support that is safety. Once people feel that safety, that trust, that connection, whatever you want to call it, they're much more compliant and they can see the end result.
Yes.
And I know I'm going off a little side tangent here, but you really hit it on the head earlier because I always kind of wonder sometimes, like, why are certain people different? Like providers, they get different responses from patients. Like, I could walk into a room and so could somebody else. What makes it different for me versus them, or vice versa? And I recognize that with myself, I do try to make it more about patient education, informed consent, truly that they understand, and patient
Yes.
autonomy, where it's not my decision, it's not my body, it's your decision, and you tell me which way we go from here. So it takes any kind of blame, I guess you could say, if they wanted to place blame on me as the provider because I told them to go one route or the other. I'll give my recommendation based on guidelines, based on experience. But in the end, I've realized that it's only going to work if the patient wants it to work. It's only going to work if the
So
patient
good.
wants the change. If they're not ready for that change and I sit here and say, you need to do this, they're not going to do it. It's only going to push them farther from me. So I think it's that safety. It's almost like a safety net or that comfort
It
level
is
that they get from you. And that helps. Helps a lot.
so good,
Yeah.
so good,
I
man.
think
And
that's the difference.
that's why you're the best.
I'll be top 10. No.
Oh my gosh! See, I think we overvalued um, IQ and undervalued EQ.
Mm-hmm. I don't think most people out there understand EQ. Do you want to give a little bit of like education on what it is? And I don't know if you have any
Absolutely,
little tips of what we're talking about here.
absolutely. To say it simply, and to help understand it a little better,
Mm-hmm.
IQ gets you hired, but EQ determines whether people trust you. Like,
That's great.
yeah, IQ solves problems,
Mm-hmm.
but EQ keeps you from unnecessary ones.
Mm.
like IQ is builds businesses,
Hmm.
but EQ builds marriages, families, cultures, sets the environment. It creates legacies. So EQ is what sets the nervous. It's the conscious awareness of managing our nervous system,
Yeah.
of being in control of how we feel and getting a better understanding of why we feel how we feel. And it
Yeah.
doesn't just live there. It starts there, but it doesn't live there because it does show up tangibly. It does show up physically
Yes.
as in the way that we address the world. So, so a question I like to ask is, what if burnout wasn't the problem, but rather it was just a symptom?
I definitely think it is a symptom for
Mhm.
sure. I think there's deeper causes, right, beneath that burnout.
Yes.
And it could vary across the thing, across the spectrum. But even if we want to talk about like earlier signs, I think burnout is more of a late sign, whereas your earlier signs, right? So,
Yes.
yeah, things you mentioned earlier with like your neurocognitive, right? Things you've already mentioned, but to add on is like you're wired, but you're tired, right? You feel like you have this energy, but
Right.
you're actually exhausted. I've noticed even myself too, like jaw clenching, and it gets really tight here, and that's because you're holding stress into your
Yes.
jaw, and maybe that's because you're trying to bite your tongue, whether it's at work or bosses or whatever, and you're just trying to keep it in. You can actually feel the muscular tension there.
That's good.
With your heart and your circulation system, you can have what feels like a racing heart, a pounding heart. It feels like your heart is skipping a beat. Now, granted, don't ignore that. That could be something serious, but just for the
Right.
context of this, you can have like intolerance to heat, facial flushing. You can even feel like tightness in your chest too, right? That's that stress and anxiety, which all comes from this. And then I've been talking to a lot of functional medicine nurse practitioners recently, and I know they relate a lot back to the gut, and it is true how much we have our gut. We're connected to our HPA axis, which has to do with our brain and our nervous
Yes.
system, and it's real. So, like having the stomach pain, the nausea, diarrhea, you can even go the other way and go constipation or bloating. These are all like early warning signs. Like we talk about our amygdala being the smoke detector and that sense of our urgency, right? And not our logic. But in our body, it's kind of like these smoke detectors or these fire alarms are starting to go off. And whether you realize it or not, they could all be related to the emotional dysregulation or the stress that's going on in your life. So paying attention to those early signs can help you to incorporate emotional intelligence, effective coping mechanisms, identifying the trigger so you can back away from it so that you can then build resistance and still enjoy what you do. Even if it's at, let's say you're at a place of business, you have a really crappy boss who's not a great leader, whatever your thoughts are, it's stress. You could still thrive in that environment if you're able to take care of yourself outside of work, separate work from work and home to home, and you create routines for yourself and really put the importance on what you think is important instead of drowning yourself, killing yourself within that job. And then later comes burnout, and then you're just done. And you start calling out of work, you
To
start
say the
hating things.
least. To say the least, right?
Yes.
You're absolutely right. Like the resistance, and a lot of us think resistance shows up as laziness, and I'm
No,
like,
no.
oh, what resistance isn't laziness? It's but misalignment, right?
Mm-hmm.
And it's understanding that your emotions aren't your enemy. You just
Yeah.
gave a plethora of insight through the different systems and how it shows up in our body.
Yeah.
And it's like emotions aren't your enemy. Um, it's what it really is. It's your dashboard.
Yeah.
And you explained that well. Like your
Yeah.
body has been speaking to you, or our bodies has been speaking to us for years. And
I'll say, don't
if
talk about me on here. I already know how tense I am. No. I'm saying all these because they're my current experiences. No, I'm just kidding. My current symptoms are coming out.
well, that's why I'm here.
That's
That's why
right.
we talk.
We need a session, Mike. You're
So,
funny.
you're funny. Um, I'll just say this. I know we're wrapping up soon.
Yeah.
It's like awareness precedes transformation. And
Mm-hmm.
for those who are looking for transformation, it begins with awareness. Like
Yeah.
you can't heal. We can't heal what we continue
Mm-hmm.
to justify. So So it's not to throw anyone in under the crosshairs of guilt or shame or anything like that.
But that can
But
happen too, as you know. Like you get guilt when you're not performing where you should, and then that can then lead to depression. Because I have people that do that too. I have
yes,
mothers, and it could be fathers too, but it's mostly mothers in my experience where they just feel like they can't take a break, they can't be by themselves, they can't take a moment to themselves, and they'll tell me they have support. They'll tell me they have their husband and their mom, for example. That's their support system. Like, well, have you leaned on them for support? Like, have them take the kids so that you can have 30 minutes to yourself, yoga, meditation, just sit down and chill. What do you like to do? I'm sorry to cut you off there, but
no, no,
I've
no.
had a lot of that lately.
It's like I triggered something that needed to
You
come
did.
out.
It was
You can see it because it's so true.
mm-hmm.
It happens every day. Is day to day.
Yeah.
Listen, for those who are watching this or listening to this, guilt is a liar. Is
Mm-hmm.
rooted in is rooted in the trap of lies. And the reason I say lies is because it usually stems from a place of a lack of awareness
Mm-hmm.
or a misunderstanding about the situation, and it traps people there.
Yeah.
I've been a victim of it. Everyone has been a victim of it.
Yeah.
That's why with guilt comes shame. Guilt is not real, and that's why we have to allow ourselves to give ourselves the permission to experience what's going on, but not live there, but do something about it.
Yes.
You don't have to believe every thought you think.
You are just reading my mind. I
Yeah.
I had a note here and I was trying to find it because I thought it was so intelligent with I'm gonna see if I can find it real quick because what you just said is just because you everything you think doesn't mean it's real or that you should believe it, right?
Right, right.
So I have people I've had patients and I'm sorry I'm looking down, it's because I'm trying to find it.
No, go ahead. And
I've
let
had
me, as you're saying what you're saying,
yeah,
so anybody doesn't feel disqualified.
yeah.
I'm not demeaning the feelings. Your feelings are real. They just aren't always reliable. But go ahead, Matt. Go ahead.
Yeah, no, I definitely agree with everything you're saying. And one of the most things I get most common is um, a patient will say, you know, okay, if you texted somebody and they
Hmm.
didn't text you back, the logical brain is, okay, well, that person is probably busy. They'll get back to me. The emotional brain is saying they don't care about me anymore.
They're ignoring me.
They're ignoring me.
They're
Exactly. So
ghosting
we
me.
have the
Yes.
emotional response and we have we'll call it the intelligent or the CEO, right? The logical
The logical.
response. When our
Yes.
logical response is acting normal, that's what we think. When our emotional side is taken over, the stress is built up, which was part of the emotions, it can do those other more negative thoughts, if you will, automatically. They don't love me anymore. They don't want to be with me. They don't want to take time for me. And in reality, they may just be busy. So always look at the other side. That's what I always tell people is always look at the other person's side to see what do you think is actually happening before you jump there. You don't know that they're ignoring you, right?
So good, Nat.
Yeah.
You summarized it perfectly. It's. I was going to say your greatest competition isn't another person. It's the version of you that keeps reacting instead
Mm-hmm.
of responding. So, and I think that's where the crux of emotional intelligence lives.
Yeah.
Emotional intelligence
Yeah.
is one of the greatest leadership skills of our generation
Mm-hmm.
because every decision begins with an emotion, a thought, or a belief. As you shared when you were breaking down the different attributes of the mind,
Yeah.
the, the people who learn to recognize emotional hijacking before reacting
Mm-hmm.
something more valuable than success. And I think that's huge. One of the biggest things we could gain in life, not to sound like woo woo or some philosopher, very practically, the biggest things we can gain is self mastery. And self mastery, which I understand it's a lifelong journey, but
Yeah.
we'd rather be moving towards it than away from it.
Mm-hmm.
Because self mastery is, to me, it's the, not to me, it is the healthy foundation of leadership, of healthy
Mm-hmm.
families, of successful businesses,
Yeah.
and ultimately a meaningful life. So that's why I do feel that the tie in with the emotional and the mindset and how they can work with each other and for each other
Mm-hmm.
to sustain self mastery is absolutely pivotal.
Yeah.
And I don't think it should go under the radar, which is why I love the fact that they're answering these questions and ensuring the light and the very real clinical points in connecting the physical attributes and how they reflect how the emotional attributes can reflect on the physical person. So I just think that's super super awesome. That, but
Yeah. Well,
I'll
thanks.
step off my soapbox. I'll let you do what you do.
No, you're fine. I was thinking we could actually start wrapping it up, and I kind of wanted just to ask a question to those that are listening so it can kind of trigger their brain to start thinking like forward future thinking, right? It can be solution focused thinking and small steps, like what you said, small victories every day, right?
Mhm.
So, if you knew that one small habit you started today could significantly improve your health, even mental health, 5 or 10 years from now, what would you actually be willing to change? So people should think about that. See how they would. I see you're
That's
already
good.
thinking about it,
That's
Mike.
good.
Maybe
Very
next time
good,
we'll come
man.
up with answers.
That's
Wow.
so good.
Yeah, thank you, Mike, as always. So insightful. And I love the emotional intelligence. That's definitely up and coming, and it's definitely really important for people to that want to be successful, that want to move forward in life the way they want intentionally. So thank you. Please, please, please tell people where they can find you again.
Absolutely. And that I'm thanking you for this phenomenal platform that you created with Thrive Well and being able to be here and just kind of share the wealth of the knowledge and wisdom that we've gained over decades. And being able to share that with the people, I think is absolutely fantastic and phenomenal.
Of course, of
And
course.
whoever's watching this should definitely take heed, take advantage, and ask questions and answer those questions. Because
Yes.
that question that Nat just gave y'all was gold. Gold. Like your future self will thank you for
Yep.
answering that question now. Again, my name is Mike Dulcio. You can find me on Facebook at Mike Dulcio, last name Dulcio. You could also find me on Instagram under Coach Mike or Mike Dulcio, the Executive Advisor on Instagram, Mike D as well. My website is also www.coachmike.org. If anybody wants to reach out, send me anything or share anything, a comment, a question, or whatever the case is, or say, no, I disagree. Here's my point of view. Bring it. My
Absolutely.
email is mindfulmandate at coachmike.org. And I'm easy to find. If you know Natalie, you can reach me.
I love it. And we're already linked on our Facebook as well. We'll put this up on our YouTube. We could probably come
Yes.
collaborate so we can get it more out to people, hopefully helping everyone from, stay at home family members all the way to those high power executives. And then I'm Natalie Tyler with ThriveWell Medical Center, triple board certified nurse practitioner, just here to help bring resources to our community and education to our public. I really appreciate Mike's input, and I'm looking forward to future episodes. So we are going to try to record every Friday, sometimes
Yes.
live. So catch us if we can get that going, or we'll just be recording. But we do want insights. We want questions. We want conflict, and conflict doesn't have to be a bad thing. It's just the other side, right? We want to be able to discuss things and have new insights, teach us something. So you have
Yes.
Mike's information. Mine should be on the screen, but you can always email info at thrivewellmc.com, and you can go on my website at thrivewellmedicalcenter.com. We'll see you next time when mindset meets medicine.
See you next time.
See ya.